Hi, everyone, and welcome back to another episode of From Print to Pod. Today, we have Dr. Santina Wheat joining us to discuss her article, What is Happening to Our Professional Identity? Dr. Wheat, welcome. Please just let us know a teeny bit about you, and then we will move right on ahead to the questions.
Thank you so much for having me. I am a family medicine physician by training, and my day job is the program director teaching other wonderful family physicians. And I work for the Northwestern McGaw Family Medicine Residency Program at Del Nor. And I am also a career and life coach and really dedicated to trying to help other healthcare workers, particularly physicians, figure out how to make this crazy life work for them.
Okay, fantastic. Now let's dive right into the questions without wasting any more time. So, tell us what inspired you to write the article, and if there was a specific moment or experience that prompted this piece.
Right now, I think that there's lots of conversations that are happening about professionalism in medicine. And some of that is very triggering because people feel like the word professionalism is a word that's used to be hard on people. But I went into medicine with the idea of this being a calling, and I really believe in the profession of medicine. And there's just been lots of conversations happening, particularly in my specialty about how do we teach professionalism? How do we teach the art of being a physician? And also, COVID really got in the way of that because a lot of that was done by modeling. And many of our trainees lost some of that modeling when we did so much that was virtual and we had less of the what it means to live this life. So that has really been in the back of my head. And then also, there's so many people that are making decisions to leave medicine, and that's okay. I just think it's important to remember that part of the training that we went through to get here really did shape our identities and shape who we are. And so we don't want to let go of that. I think it's important to remember that that training is an important aspect of your everyday life. It has shaped how you live every day and to not forget that. Siloing that off can just make things worse because it's closing off part of you. It doesn't allow you to be the authentic you.
Thank you for that. You emphasize that physician identity is more than just a job title. It's a deeply ingrained part of who we are. How has your own professional identity evolved over time?
I think I've sort of gone back and forth. I think that I was all the job for a while, and that was because I thought that's what I had to do to get ahead. And then I became a mom, and then it was like, oh, but you have to stop being a physician when you get home. And I personally found that to be more challenging. It meant that I couldn't share what was going on at work at home in the same way, and I had to sort of turn that off. And that just didn't feel right to me. And when I started living all of it, when I started bringing some of those things home more intentionally, of being able to say, oh, this is what mom did during the day, or being able to talk about it in ways so that my friends understood it and my family understood it, that improved my well-being, that improved my ability to show up as my best self at work and show up as my best self at home. And I've watched people say, oh, just treat it like a job, clock out at 5 o'clock. And that sort of ignores the challenges that we have of thinking about that patient that we're worried about, of reflecting on perhaps that mistake that happened during the day. It just sort of turns off an important part of being able to process and move forward. And when I realized that I couldn't silo in the same way, I just became a much happier and honestly more effective person in all aspects of my life. And now I'm working on teaching that to my residents too, that it's okay to turn things off. It's okay to not want pajama time, but this doesn't mean that that aspect of your identity goes away.
Thank you for that. So the next question is, in your article, you discuss the challenges physicians face in maintaining their professional identity amidst systemic changes. Can you elaborate on some of these challenges?
Think that there is the challenge of when I see my patient in a room, I feel like I'm battling with them. I'm there trying to be that advocate for them. I am battling for the best healthcare that they can possibly have and to show them that I really care about them while also facing the time pressures that we all face in this day to day, while also advocating for the system and trying to make things different. That's an everyday thing. But right now, in this moment in time, we're also seeing huge changes in medicine based on our political climate, based on financial climates, and we are trying to figure out how to hold our head above water amidst all of this change. And it almost, I don't know if other people will feel this way, it almost feels like COVID did, but for different reasons. It's just the constant challenges of the system changing every single day. And what I can say is that when I can hold on to my identity, when I can hold on to the truth of my professional identity is that I want to help people, that I'm here to ensure the better health for other people, that I'm here to ensure the better health of my community. When I can hold on to that, that gives me a lodestone amidst all of this chaos because right now it's nothing but chaos. But that gives me something to hold on to. And I can confidently say that to my teams. I can confidently say that to my patients. And I can confidently say that when I come home and tell my kids why I go to work and do what I do every day. And so really it's about having a purpose, having a reason that that is part of who I am. And it makes each of those days a little bit easier.
How do you think the rise of social media and digital platforms has impacted physicians' sense of professional identity?
I think that's a great question, and I think it goes sort of all over the place. I think that for some people, if you look at social media and you're looking at the people that are not physicians and healthcare workers out there, it can feel very harmful to the professional identity because we can feel like, oh, we're watching these influencers that are going against everything that we're trying to do in the exam room, that are going against all of the conversations that we're trying to have, or advocate for on a national stage. But at the same time, I think it also can, when used well, instill confidence too. There's nothing like the experience I had just a week ago. I was at a conference and somebody walked up to me and said, you know, my program follows you. You're really giving some of us hope. And that was an amazing confidence booster for me to know that something that I was doing matters. And so I think just like many things, it is all in how you use it. If you can use it to share what you believe in, if you can try to shut down the noise a little bit and not let that part bother you, then it can be an amazing place for inspiration and growth.
I'm going to jump in here and say that Dr. Santina Wheat was actually a speaker at our Leadership for Women online conference this past January, and you can access that on our site. You could still access it even though the conference is over. It's now an evergreen course. But additionally, Dr. Wheat is joining us as a faculty member in the second annual SoMeDocs Leadership Conference. So I hope that you all check that out. Okay. Next question is, you mentioned the importance of authenticity in the medical profession. How can physicians balance authenticity and professional expectations?
And I think this is where it really comes into having your profession sort of be just part of your identity. If I can show up as my real self everywhere that I am, then it improves my balance. Some people know of the term code switching. Some people talk about that as something that's really hard, where you have to show up in this situation looking this way or speaking this way. And I think that's what some of us try to do in medicine. We try to code switch. And that is exhausting and draining. And I talk about code switching in the work that I do with inclusivity. And when we can have spaces that allow you to remove that, oh my gosh, you spend so much less energy and you feel so much better. And so this is why I really do believe that if you just show up as your authentic self, you can choose to not make certain statements. You can choose to not make certain jokes. Like there is a way of, yes, knowing that certain things are not appropriate in every session or every setting. That that is different than not being authentic. But when you can just bring your full self to every place, the balance is just easier because you're being intentionally you and you're not trying to change this part of yourself to be able to be successful.
Okay, thank you for that. What role does mentorship play in shaping and preserving professional identity among healthcare providers?
Well, I think that mentorship is one of the most valuable and most underutilized things. And I will go back to my concern about what COVID has done to some of us for modeling, because I have watched some of my younger trainees not understand the benefit of mentoring and not be willing to seek it out. So mentorship is so amazing because you can have somebody tell you how you are reflecting out. You can have someone give you the perspectives and the challenges that they have had throughout their careers or the stumbling blocks that they have faced and help you learn how to navigate those along the way. I will say I can never have been where I am. I would have never had any of the positions I've had. I would have not been willing to try to write or to be out there had it not been for people who told me about their own experiences and the joys and pitfalls of some of those things along the way. But when you can have someone that looks out for you and says, "Oh, maybe you should try this thing," or "Maybe do this next time," or "Think about this opportunity," um, they're opening your eyes to this world that's out there that you maybe didn't know existed. And so I really do believe it's one of the most valuable things as an individual to be mentored. But then flipping the script to be a mentor yourself is also one of the most valuable things also. And so that can be your being a peer mentor, that can be being a mentor for somebody that's above or below you in the process. Um, Many of us in medicine are caregivers at heart, and it sort of hits that same dopamine pathway, in my opinion. Being able to help someone along the way can really be meaningful for you too. It can bring more joy, it can bring more purpose to all of the things that you're doing, and allow you to make a bigger impact. Sometimes that's just what it feels is that you just want to make that impact, and reach so many more people.
So thank you for that. And can you share an example of a time when your professional identity was challenged and maybe how you navigated that experience?
I have found the biggest challenges to be really in the middle of patient care, where someone felt like I was doing something that they were just a widget, where a patient or a patient's family member has been like, "You're just doing this because of pharma," or "You're just doing this because I'm a widget and you're trying to get revenue." And that was so hard for me because it's nothing about who I am. It was not true. It was not authentic, but it's what someone else was seeing. And so this was so hard because you think that you're portraying who you really are. You think that you're trying to reflect out to the world all that you're working for and all that you have done up until this time. And to hear someone feel like you're not looking out for them or you're not caring about them. That sort of hits at the core. That feels horrible. And especially when you're going through the training of hearing that other people's perspectives are their realities, right? You really want to make people believe in what it is that you're doing. And so the next piece is probably like, how do you manage that? And sometimes knowing that it's sometimes okay just to show up as your best self. It's just okay to show up with your true purpose and your true authenticity and know that even when you do your best, everything is not going to land how you want it to. Sometimes just knowing that your best is good enough and that we will not always have perfection. That is the best thing that I can do for myself, for my well-being, and try to help other people in that too. But that having that identity challenge does hit your core and it makes you wonder, why do I do this every day? And so the other piece of going after that is thinking about, but what were the good things that happened? So whenever I have a situation like that, I try to remind myself of the other patient that said, thank you so much for listening and being here for us. Or the learner who said, wow, I really learned something today. I try to combat those times when I'm pushed with the positives and have gratitude for the things that are going well.
Fantastic. And the last question that I'm going to round out this episode with is going to pertain to medical training, which is perfect because Dr. Wee, you took part in our month-long speaker series called Optimizing the Application and Interview Process for Med and Pre-Med Students. Your
Mhm.
particular lecture was called Ace Your Residency Interview, Stand Out, Shine, and Secure Your Spot, which really was fantastic. So with that in mind, what advice would you give to medical students or early career physicians about developing and nurturing their professional identity?
I always am going to say start with what your purpose is. Start with what you care about, with what is true to you, and show up every day and live that. When you can live that, other people can see that. And once you start doing that, make decisions based on what your purpose is. Make decisions on who you apply to work with. Make decisions on what jobs you take based on that purpose. Because if you make decisions that are not based on that purpose, then you're going to be frustrated. I'm going to say, especially for early career physicians, we see, particularly in my specialty, that the 3 years of residency and the 3 years out afterwards are some of the hardest times. It's some of the worst times for burnout and feeling like you can't connect to this job. And so, if you can make decisions early on that say, I'm going to go work for an organization that aligns with what I want to do with my life. I'm going to go work for an organization and take jobs that allow me to live my purpose. Even if it's 30% of the time, you want to make sure that that's there. It can't all be about the money. Some of it will be because, of course, there's debt and all the things, but make sure that purpose is part of the conversation.
Okay, thank you so much for your input. Everybody that's listening, check out the article, What is Happening to Our Professional Identity? Dr. Wheat, thank you for joining us.
Thank you so much for having me.